This time, I'd like to hand the mic over to Andrew Fong, who will talk about local domestic issues.
Dr. Lawson, my first question is for you. As a result of a 2001 North Carolina General Assembly reform, mental health care facilities have deteriorated or discontinued services across North Carolina, including the 4th District. The net effects are inadequate resources to treat the mentally ill patients and lack of continuing care, leaving many impoverished and without care. This is a part of a larger trend in the United States. If elected, what would you do to address the state of mental health care in North Carolina and the rest of the United States?
Sure. Well, I think this is a critical issue, both for mental health as well as for health care in general. We are suffering under a system of health care that currently has little to do, nothing to do with the patient and the provider. Our system of care in this country has been hijacked by corporate interests that have learned how to leverage governments and government agencies for their own profit and recurring revenue. That's not why I went to medical school to become a doctor. And it was very discouraging to see this play out both in the hospital, in the outpatient setting, in the mental health setting, where we have governments that are taking and consolidating power, consolidating purchasing power, but instead of using it to benefit the people, they're using it to benefit agencies that really don't care about the patients, and the control is being taken away from the patients and the providers. My commitment to fix healthcare is not a part, it's not a Republican plan, it's not a Democratic plan, it's just a plan to put the power back in the hands of the patients and the individual providers. And yes, that does include using local resources to fund local safety nets to deal with things like mental health, which are absolutely critical.
Congressman Price.
Let me just say before I answer that we're still looking for a question as to whether NIH research and National Science Foundation research are in fact unconstitutional and therefore should be completely wiped out, federal funding for that kind of research. As far as mental health is concerned, the question specifically is about mental health. Mental health is one important area of NIH research. I have, for many years, felt that it was underemphasized as an area of NIH research, and have supported budgets that would bring our mental health research efforts up to par with our research on other maladies. And then when it comes to treatment, there is a huge problem, a huge disparity between the way mental health conditions are insured and the way physical conditions are insured. And one of the provisions, it was done in a kind of unorthodox way, but I'm so glad it was done. One of the things that Dr. Lawson mocks about that economic rescue bill was it contained within it something we've been trying to do for many, many years. That is the parity provisions for mental health legislation, so that at long last, insurance companies will be forbidden to discriminate against mental health conditions. Whatever deductibles, whatever co-payments are there for physical conditions cannot be made greater, more onerous for mental health conditions. That may seem like a small thing, but it isn't a small thing. And so many people in our community have been denied adequate care because of that kind of insurance discrimination. Now, some people so believe in the free market that they somehow expect insurance companies to, out of the goodness of their heart, I guess, to solve these problems without, quote, the heavy hand of government. Well, I'll tell you, sometimes the government needs to weigh in on behalf of the people, against discrimination, and for fair treatment.
Dr. Lawson.
Regarding the constitutionality of NIH funding, folks, we are so far away from talking about what's constitutional right now. We're talking about a Congress that doesn't read the Patriot Act before it votes on it. Why don't we start by reading the bills? Why don't we start by not delegating rulemaking to unelected bureaucrats? Then we can go to the advanced class and talk about what's actually constitutional, because we're clearly not following that either. But with respect to it being a good thing that we hid something nice in $150 billion of other stuff, folks, that's more of the same. That's what we've been doing. That's what's bringing our country to its economic needs. We absolutely need change in Washington, and it needs to start by rejecting a broke thought process that you can run a government in a way that lets 435 people go out and promise anything they want to their corporate donors to get reelected, and they go spend the rest of their time trying to do it.
The answer, I think, in case you missed it, is that NIH research is unconstitutional, and NSF research is unconstitutional, and so it shouldn't be funded, and it might be an inconvenience if we can't get to that right away, but the intention would be eventually to cut out federal funding for that research, and with it, the national strength that comes with it. As far as the mental health parity is concerned, I've worked for many, many years to get this done. And as I said, this wasn't quite the unorthodox, this was not quite the orthodox way to do it, but I'm very glad it's been done. And it's been legitimately done, and it's going to make a difference in the lives of millions of people. We have major state challenges with respect to mental health. One of the ways I've used my position on the Appropriations Committee is to get some funding directed toward providing mental health beds in Wake County to help compensate for the closing of Dick's Hospital. And you know, that's just barely the tip of the iceberg. But there's a big challenge in mental health in particular with our returning soldiers, our veterans. It just needs to be addressed. It needs to be a national priority to remove the stigma and understand that mental health conditions need to be treated like other health conditions.
Congressman Price, my second question is